Cardiovascular system. 1. Heart chambers, right and left atrium and ventricle. 2. Left and right ventricle difference. The right ventricle receives the deoxygenated blood from the right atrium and pumps it to the pulmonary artery. The left ventricle, on the other hand, receives oxygen-rich blood from the left atrium and pumps it to the aorta. 3. Left vertical is able to pump blood in the whole body because left vertical is thickest and strongest. 4. The pulmonary veins are the veins that transfer oxygenated blood from the lungs to the left atrium heart. 5. The pulmonary artery carries deoxygenated blood from the right ventricle, heart, to the lungs. 6. Heart valve, 4 valves, tricuspid, mitral, pulmonary, and aortic. 7. Systolic and diastolic BP definition. Systolic, ventricles contract, and diastolic, ventricles are relaxed. 8. What are the types of blood vessels? Artery, veins, capillaries. 9. JVD location / jugular vein distension, neck 10. Thrombophlebitis, inflammation of the wall of a vein with associated thrombosis. 11. Declotting, remove blood clots. 12. Thickest and strong chambers of the heart. Left ventricular. 13. Example of beta blocker drug, atenolol. 14. Function of venous valves. One-way valves in veins prevent blood from flowing backward. 15. Leukopenia, low white blood cells. Digestive system. 1. Parts of digestive system. A. Mouth. B. Esophagus. C. Stomach. Cardiac sphincter. Cardia. Fundus. Tail of the stomach. Pylorus. And the pyloric sphincter. D. Small intestine. Duodenum, jejunum, and ileum. E. Colon, cecum, the ascending colon, the transverse colon, the descending colon, and the sigmoid colon. F. RECTU, MCPC Anatomy 2022. G. Anus. Z. Accessory organs, salivary gland, pancreas, saliver, gallbladder. 3. Sialoadenitis related to digestive system. 4. Warthin's tumor, salivary glands, digestive system. 5. Zollen, spleen, stomach, pancreas. Respiratory system. 1. Respiratory system. 1. Part of respiratory system. A. Upper respiratory tract. Nose, nasal cavity, concha, paranasal sinuses, the pharynx, nasopharynx, oropharynx, and laryngopharynx, larynx. B. Lower respiratory tract. Trachea, bronchi, primary, secondary, and tertiary. Bronchioles, including terminal and respiratory, and lungs, including alveoli, pleura. 2. Tuberculosis, TB, is caused by a type of bacterium called Mycobacterium tuberculosis. 3. Upper respiratory endoscopy is done by laryngoscopy. 4. Pneumonectomy, removal of lung, lobes. Urinary system, 1. Which carries the urine from the renal pelvis to bladder ureter. 2. Which carries urine from bladder to prostate to outside, urethra. 3. CIWESRD. Urinary system. 4. Which system does kidney belong? Urinary system. 5. Dysuria, painful or difficult urination. 6. Incontinent, leaking of urine that patient can't control. Reproductive system. 1. Female reproductive system. A. External organs. The vulva consists of all of the external parts, includes the mons, pubis, labia majora, labia minors, Bartholin's glands, clitoris and vaginal opening. B. Internal organs: vagina, cervix, uterus, fallopian tube, ovaries. 2. Oophorectomy equals surgical procedure to remove the ovaries. 3. Salpingectomy equals surgical removal of a fallopian tube. CPC Anatomy, 2022. 4. Bartholin's glands secrete mucus to provide vaginal lubrication. 5. Ova produced by ovary. 6. Progesterone thickens the endometrium for implantation and is necessary to sustain. Pregnancy. 7. Menorrhea, normal menstruation. 8. Menorrhagia, heavy menstrual bleeding. 9. Metrorrhagia is uterine bleeding at irregular intervals, particularly between the expected menstrual periods. 10. Metrorrhagia. Menometrorrhagia is a condition in which prolonged or excessive uterine bleeding occurs irregularly and more frequently than normal. It is thus a combination of metrorrhagia and menorrhagia. 11. Dysmenorrhea means painful menstruation. 12. Colposcopy, examining female genital. 13. Corpus luteum belongs to ovary. 14. Colporrhaphy, repairs suturing weaknesses vaginal walls. 15. Colposcopy involves which organ? Examining female genital. 16. Body part not included in female organs. Vulva, Bartholin's gland, Cowper gland. Answer: Cowper gland. Male reproductive system. 1. Male reproductive system. 1. External genital organs. Paris, scroturn. 2. 5. Image taken back to front posterior anterior. 6. Which statement is true? Which statement is true for carpal and tarsal bones? Carpal bones are present in hand. Tarsal bone. 7. Congenital claw, toe. Hallux malleus. 8. Osteoporosis, osteopenia, reduction in bone mass, bone mineral density, BMD, diagnosed by DXA. 9. Shoulder joint bones, head, upper end of the humerus, and scapula or shoulder blade, and the clavicle or collarbone. 10. Pronation, turning the hand so that the palm is down, adjective prone. 11. Supination, turning the hand so that the palm is up, adjective supine. 12. Phalanx, bone. 13. Bone-to-bone connection, ligament. 14. Muscle-to-bone connection, tendon. CPC Anatomy 23-23. 15. Foramina magnum, opening in the occipital bone and passage of the spinal cord and meninges, spinal blood vessels. 16. ORIF, open reduction and internal fixation. 17. Sciatica, radiating pain to which part leg, arm, low back pain. 18. Sesamoid bone belongs to carpals. 19. Sac, like structure at buttock, prone position, pilonidal cyst, Bartholian cyst, Baker's cyst. 20. Hip is in which cavity? Pelvic cavity. 21. Appendicular skeleton, bones of shoulders, pelvis, and limbs, including arms, hands, legs, and feet. 22. Axial skeleton, bones of head, neck, back, and chest. 23. What is the location of fracture in distal humerus? A between proximal humerus and shoulder. B between shoulder and elbow. C between supracondylar and epicondyle. Immune system and lymphatic system. 1. Which system fights against antibodies? Immune system. 2. Spleen, part of which system? Immune system, lymphatic system. 3. Function of spleen. Filter and destroy the RBC that are no longer efficient. 4. Red blood cell destruction occurs in the spleen. 5. Belong to lymphatic system, pancreas, spleen. 6. Macrolytic anemia. Bone marrow produces abnormally large red blood cells. 7. Splenorrhaphy, repair of spleen. 8. Which gland is present in mediastinum? Thymus. 9. RBC and WC and platelets present in which system? Hematological. Integumentary system. 1. Transplant donor cell, allograft. 2. Patient is received the graft from the close relative allogenic graft. 3. Melanin, black pigment occurring in the hair, skin, and iris of the eye in people and animals. It is responsible for tanning of skin exposed to sunlight. 4. Trichomyces, fungal infection of hair. 5. Hair-related diseases, like tricho they mentioned.